This video is a demonstration of the physiotherapy clinical assessment for the thoracic spine. For the thoracic spine, besides the general observation, palpation, we also have specific focus palpation and joint intervertebral movement. Again, I suggest before the examination, you have some hypothesis in your mind first. We have some target hypothesis to do the examination. First of all, for general passive intervertebral movement, just as usual, use a pisiform grip to see any particular stiffness and pain. Thoracic spine is particularly stiffer than the cervical spine or the lumbar spine because it has one more pair of joint, costovertebral joint, and one more pair of ligament, costovertebral ligament. So it is more stable. And also the alignment of the spinal process is more inclined. So sometimes we do the pisiform grip passive intervertebral movement, we do with an angle like this. Okay, this is the PA one. And for the unilateral PA, still the same on the facet joint. But more on thoracic spine, we do more the transverse glide. Because the thoracic has a lot of rotation movement, we will see the mobility of the transverse glide. See how it's the rotation movement. And for one thing, then we also check the ribs. How we check the ribs? If the patient complaining of pain around here, beside of the intervertebral joint, we also check the costovertebral joint. We check it not just next to the spine. Usually we test it like for example, the spine and the side of the body, joint midline. You can find the most prominent angle of the costal angle. Why you press on the costal angle? Because a lot of soft tissue compression is around the costal angle. And also when you press on the costal angle, the ribs has some movement. This movement create very obvious associated movement of the costovertebral joint because it's long lever arm movement. You can see if I press here, the movement here is more obvious at the costovertebral joint. So that's why we press here. There's also the reason that when you examine the upper costovertebral joint or intervertebral muscle, the patient arm need to put on the side like this because you need to slide out the scapula to expose the costal angle here, easy for you to do the examination. What other hypotheses you can in your mind is that first, for the thoracic spine, we have a very famous condition called T4 syndrome. Not exactly to the T4 level, it's about the T4 to 8 level, which is very prone to have some compression irritation. And it affects the parasympathetic nerve, so that's why you irritate some discomfort feeling in front of the chest through the dermatome area and through the palm area because it's parasympathetic nerve. And another common condition is costovertebral pain. That patient complain of discomfort in the upper back is actually caused by the costovertebral joint. Usually before the palpation, we ask the patient to do a deep breathing first. See if the end of the breath, the full inhalation, do they feel any pulling, discomfort in the upper back area? Then we check on it. Those are the two major conditions. And one more accessory movement I want to show you is that on the specific level of the spinal process, so we do the pisiform on the bottom of the spinal process and the other opposite hand on the opposite side, the superior border of the facet joint. Okay, we do a rotatory PA. Why we need to do that? Because the thoracic joint usually has more intervertebral movement. We call that cephalic. It's more mobility and more stability. So this one we can check all kind of stability and mobility, see any pain. Sometimes we incorporate with the full inhalation and expiration. We can even do a manipulation thrusting. The last thing is the myofascial checking. If you have learned the myofascial release pattern, you know that we can do you open up our fingers to feel the tension of between the skin, fascia, and the bone. See any particular increase of tension if some people with particular Myofascial pain, when you do this lifting up, they can feel very painful, but the pain is very short term. So once you let go, the pain also stops. Those are the clinical physiotherapy examination I recommend in the thoracic spine assessment.